My name is Yetta McCullum, and I am a periodontist. I'm a diplomat of the American Board of Periodontology. Periodontist cares for the support of the teeth. So basically, I am the person that's responsible for the foundation of teeth and implants. So I treat all matters involved with infection, support of the teeth, chronic infection known as periodontitis. I help people keep their teeth for a lifetime, or if they have lost teeth, I do all I can to help them keep their implants for a lifetime. So that's what a periodontist does. I grow bone, I grow gum tissue, I help prevent the loss of bone support. So I do many things to also help patients' overall health.
I was watching the dental commercial and I saw it, and based on what I was hearing, I knew I should give them a call. And I called. The person that I spoke to, set up the appointment, the initial consultation. I came in, I was very nervous. I spoke with Dr. Yetta. She did the initial consult and we talked. I felt so comfortable that, I told her, okay, I'm in, I need you. I needed her.
She was very nervous, but because of what she saw out here on the internet or one of our infomercials, she got up the courage to come through the threshold. And once she did, she was so relieved. And so we were able to take care of her. Her main concerns were that her teeth were shifting and she knew something wasn't right.
I've always had, or was always told, I had a great smile. Never really had any issues with my teeth, so it was easy to put my teeth to the back burner. One day I looked up and I looked in the mirror, and what I saw was no longer that bright, beautiful smile. It was something that I had become a little ashamed of. It was a moment of reckoning for me, and I didn't know who to turn to. And again, I just prayed. And that's when I saw that commercial, and that's when I saw Dr. Yetta. And that's when this journey began.
We went through the steps of moving her teeth back into a lovely position. So she had the LANAP procedure and the bone regenerated around her teeth, and I was able to help her get her beautiful smile back. And so she's been with me ever since and keeps up with maintenance care, and she's just my princess. She really has been one of our successes.
To be told your smile is beautiful, it's priceless. Words can't put the feeling that you get when folks look at you and they say, wow, your teeth are great. You have beautiful teeth. Your smile is beautiful. Every dime that I spent, I do it again and again and again. I don't have one regret. So I say, get off the couch. I say, go to the website, make that phone call. At least take the first step. After that, if you don't feel it, it's up to you. You have to feel that.
LANAP stands for Laser-Assisted New Attachment Procedure. It's also known as Laser-Assisted Regeneration. The PerioLase is a laser that was made to help patients keep their teeth, control the active infection, and regenerate the bone that's been lost around their teeth.
She went in and noticed that I had a little gum disease. One of my teeth had a hole in it. And that's right where the chip went in at. And so she had to remove that tooth to make sure all the rest were okay. And she did some procedures on my gums to straighten those out. And my mouth been feeling wonderful ever since. I'd never been to the dentist before in my life. I'm 54 years old. I was nervous when I first came in because I don't really have a thing with doctors, and of that nature, and so I was just nervous going in. And when I first walked in the door, the atmosphere is so inviting and welcoming, you know what I'm saying, that it just put all that ease. And then as you actually talk to them and they explain to you what they're gonna do, what you need done, the procedure, it's just warming, you know what I'm saying? They make you feel like old friends.
As a periodontist, I feel like I'm intimately involved with a person's quality of life, longevity, because periodontal disease is associated with a lot of other chronic illnesses, diabetes, infections, hypertension, stroke. So I really feel like I'm helping in a lot of different levels as a periodontist.
My name is Dr. Cornell McCullum. I'm an oral and maxillofacial surgeon. The specialty of oral and maxillofacial surgery encompasses a variety of procedures. These include removing wisdom teeth, removing broken down teeth, replacing these teeth with dental implants, dealing with oral pathology, handling temporal mandibular joint problems, the facial cosmetic surgical component or non-invasive cosmetic component. The facial procedures I perform include repairing elongated ear piercings, split earlobes, removing facial skin tags or moles, Botox or similar related products.
As a man, you don't really realize, I don't really look in the mirror and notice things, and I guess moles kind of pop up over time. Someone had pointed out that your moles are kind of cute on you, and I didn't really think I had any moles. And so I was going to Dr. McCullum's, and they just happened to mention that they had this service. I was in one day, and within 3 days, healing up very well, and I was amazed at the before and after picture of my face. I had no idea. I really hadn't paid any attention to how many I had. It was very affordable too. So it was just another addition to the services that they offer from the Dental Dream team.
Often men do not think about having some type of facial cosmetic work done. Usually it's women in our society. But two patients come to mind. You'll see their before and after pictures, and they decide to have some of their DPNs or their facial moles removed, and the results are just tremendous. They're dramatic changes. And when you see the before and the after picture, you can really appreciate it having done. It really removes or erases some of the years and gives a more vibrant, bright appearance.
Skin tags all around my face, behind my ears, and I had a really large one in between my eyebrows that looked like I was growing a third eye. Before, I lacked confidence. I had very low self-esteem. I didn't want to go out without makeup. I felt people were staring at me because it made me look a lot older than what I am. And now afterwards, and I even told Dr. McCullum that after the procedure, it gave me my confidence back. And now I can wear my makeup. I'm not trying to cover up something. I'm wearing makeup to look nice again.
I came to the Dental Dream team because I had a keloid and it was starting to bother me and grow over the years, so I needed to get it removed because it was starting to affect my sleep and itch and just affect my daily life. Dr. Cornell McCullum removed my keloid for me.
I saw a commercial and I saw Dr. Cornell McCullum, and he was speaking about the ear reconstruction, and for about 7 years I was walking around with the split earlobe, and I had been wearing clip-on earrings for so many years, and I couldn't wear family heirlooms, my mother's diamond earrings, and I got tired of it. And so I said, Keena, you need to stop. And I saw the commercial and I called them. My summary of the Dental Dream Team is that I went in to be a patient for ear reconstruction. And after going there for the ear reconstruction, I decided, oh, I should be a dental patient here as well because I like the office so much. So I think overall it's just an excellent experience. And from beginning to end, from the front desk to the services that you receive behind the doors with the doctor and his assistants, everyone really is treated respectfully and appreciatively that you chose them.
I worked first with Dr. Yetta, who did a LANAP, and that's going into the gums with the laser, and that was a dream compared to the way they used to do it with the surgery and the stitches. So that was really uplifting and easy to take. And after that, I saw Dr. Cornell, who also started preliminary for 2 implants.
Dental implants are a wonderful replacement for teeth. They can be replacements for individual teeth or a segment of the mouth, or they can be replacements for the entire mouth if people are missing all of their teeth.
After fillings, root canals, crowns, all of this, and I still wasn't eliminating the underlying problem of unhealthy gums. It was suggested by Yetta McCollum and Cornell McCollum to explore implants. And so I started with a couple of implants, and then those went well, so we decided to take care of as much of the problem as possible. And it really has changed my life. I'm confident in my smile, and I have to talk to a lot of people at work, so I'm always grinning, and my overall health, I do believe, is better.
I would think of ourselves as just a collective group of specialists that have honed our skills. So we're masters in the procedures that we perform, and we do this together to provide patients with an overall competent, efficient care for dental work and for oral and facial work. I think the benefit of having this group of specialists under one roof makes treatment plans and procedures move more quickly and efficiently through the process.
I especially love the collaboration and being able to kind of have a one-stop dental shop where I can go in and have my teeth cleaned if that's what I need, or an evaluation to see what next steps that need to be taken. And I can schedule around my work time and their schedule to get everything that I need done.
My name is Dr. Robin L. Ferguson. I am the General Dentist for Dental Dream Team Chicago. My role at Dental Dream Team Chicago is a general practitioner. I do full reconstructive dentistry, not limited to implants, aesthetic dentistry, veneers, crowns, bridges, partials, dentures, anything that's needed to create a beautiful smile.
I used to notice that people looked at me funny because of my teeth. I had protruding teeth. I had one of my teeth were brown in the front of my mouth. I was a little ashamed, but I tried to play it off. But once I did what needed to be done, that all changed. It sent my self-esteem higher than it was, much higher.
Monica was a very interesting case. She came in hadn't had dental treatment in a long time. This is a patient that had advanced gum disease, had missing teeth. Her bite, her occlusion was completely off where her teeth wouldn't close completely. She had large spaces between her teeth. And so Monica went completely through A to Z. She started off first with Dr. Yetta to get the periodontal disease under control.
Dr. Cornell started pulling my wisdom teeth. Once he pulled my wisdom teeth, I was then sent to Dr. Ferguson. Dr. Ferguson did what she needed to do.
She had what we call AOL surgery, which helps prepare the bone for rapid tooth movement, because she had orthodontic treatment, that's braces, to correct the bite, to align the teeth back. Once all of that was completed, which took several months, so again, this is staging treatment out. So when treatment is staged out, patients are able to afford treatment more. It seems as if it's more within their reach instead of saying, oh, it's gonna cost X amount of dollars, and they look at you and say, I can't afford that all at once. We're able to spread it out.
It's been a very good experience that I've had. I've never really had the fear of dentists, but if you have the fear of dentists, this is the place to come because they make you feel like you're in their living room.
I think the biggest thing that is so rewarding for us as practitioners, we see these patients come in, they're devastated, they hate the way their mouths look. By the time we get them completely through, their whole personalities have changed. It's like this other person comes out because they're smiling, they're happy, they're not ashamed of their smiles, they're not holding their heads down, they're not putting their hands over their mouth. They genuinely feel good about themselves. To the point where Monica said through treatment, you know, when I get married, I'm inviting the Dental Dream Team to my wedding. And sure enough, she did get married, and sure enough, we went to her wedding. It was fantastic.
I've referred several people to Dr. Yetta and Dr. Ferguson, to the Dream Team, and people are just like, wow, they did an amazing job. And I give all the credit to them because they are thebomb.com in my book.
Before, I would barely smile because, you know, I had teeth that were missing and I had a bridge that was broken, so it was a very difficult period for me, and I'm an attorney, so, you know, I'm always talking to people. I would barely smile because, you know, I had teeth that were missing, and I knew that there was another person inside me that needed to come out, and I needed to be in a position to smile. I feel comfortable with smiling and talking. I'm not covering up my mouth when I speak, and I get compliments all the time in terms of how nice my smile is. That's just a confidence booster for me. I'm really pleased with the work that they did, and I like the dentist, and I'm just, I'm really happy, you know, with my smile.
I think one of the biggest things to help patients to feel more relaxed is for that first appointment, just walk around, look at our facility, meet the practitioners, the dentists that are here, so that you're able to feel comfortable with all of us. I usually like to spend at least an hour appointment with all patients, but maybe a little bit more time with the fearful patient, because usually they have a little bit more anxiety. All the questions may not come right away to them, and you know, we may need to help them to get through that, what they're looking for, what is causing them to be so fearful, and address those fears. The beauty with being here is that all of the dentists here are certified in sedation. So we have various levels of sedation, whether you just come in and get a nitrous, which is the gas, or whether you take a pill, which relaxes you and you really don't remember much. Or whether we bring in an outside entity that comes in that's mobile type of anesthesia, where the anesthesiologist comes in with the anesthesiologist nurse, and they sedate you, and then we're able to do the treatment, and you really don't remember everything. Sometimes just talking through the treatment and what's going to happen can really help a patient get over their fear. Instead of doing a lot of treatment all at once, maybe doing treatment in small stages so that they can get comfortable, so that they know that we're not here to hurt them, that we're here to actually help them. So I think communication is key with helping that fearful patient and talking to them and allowing them to feel at ease with the treatment that they're getting.
several things done. After looking at my situation, I was given 2 options, and I chose the latter option, which included a stint with ortho. And once my orthodontics was finished and removed, I came to Dr. Cornell for a dental implant. And then once the implant was healed, Dr. Yetta did a crown lengthening procedure for me, and Dr. Ferguson finished it up with and maintaining throughout the procedures the temporary crown work that was needed.
I think having a beautiful smile, being confident in your smile, being able to be out in public and not be embarrassed or afraid to be yourself because you're not able to express your happiness, not being able to go out and eat with your friends or socialize because your smile just isn't where you want it to be. And so that can really hinder people. That can hinder a person from getting that job that they want because the company that's trying to hire you looks at you and you won't look up and you won't smile and you won't have that warm fuzzy feeling because you're grumpy looking or you're unhappy because you can't smile, or you feel you can't smile because you're missing teeth or your teeth aren't where you want them to be. And so that's very important.
I am very happy with my smile. I never thought I would enjoy my smile again. I had to teach myself how to re-smile after having one dental thing after another and being embarrassed with having braces and having them removed and everything, but I am 100% pleased with my smile.
Within our practice, I think what I pride myself on the most is that we work together as a unit. And so our practice is, I think, extremely unique in that we have a general dentist, we have a periodontist, we have an oral surgeon, and he's also an MD. And so it is just so wonderful to be able to work with such talented, skilled, conscientious clinicians. It's just a blessing, and it brings great joy to me because it makes my job, what I do, so much easier. You need to have a solid foundation. And so Dr. Yetta McCollum and Dr. Cornell McCollum provide that solid foundation for me to be able to create wonderful, beautiful smiles.
One of the most satisfying things about our practice is seeing and hearing patients' heartfelt thanks and their appreciation for how we've served them, profoundly changing and improving their lives, and I'm getting to do something that I truly enjoy doing with my mind and my hands.
Because when you have a healthy smile, you feel good about yourself. It exudes. The self-confidence, it rises. And I'm just saying, if you are struggling with deciding whether or not you want to make that decision, it's not cheap by any means. I'm not saying it is, but it is an investment. But it's investment in you. You know, we can buy cars, we can buy furs, we can get weave and everything else. Put some of that money into your mouth and see the difference.
It's important to call the Dental Dream Team for a consultation to find out what you need, how much it's going to cost, and how you can get it done. So call, go to our website. You can make appointments online at certain times. You can send us an email. We are here. Your smile is worth it. Your health is worth it. You're worth it. So give us a call.
Did you know that you could have gum disease and not even know it?
I had the LANAP laser procedure, and what she did was remove the tooth that she saw had a hole in it and did some gum work with that procedure to make sure to strengthen my gums back up, and my mouth been wonderful ever since.
Having a beautiful smile, giving you that confidence that when you smile and talk to people, that you are putting your best presentation forward.
With over 20 years of experience treating gum disease, Dr. Yetta can put you at ease with many options she offers for a healthy, attractive smile. Put your money where your mouth is, and for a limited time only, get 50% off your first gum exam. Call today, 773-488-3738, or visit our website for more information, because your smile is worth it. Are you ashamed of your smile because of missing teeth?
I recommend to anybody who needs some procedures done to their teeth. They do all kind of, not just dental procedures, but facial procedures.
I had skin tags all around my face. I had very low self-esteem. I would advise anyone, if they have mole removal, skin tag removal, come on in and at least get a consultation.
I went in to be a patient for ear reconstruction, and after going there for the ear reconstruction, I decided, I should be a dental patient here as well, because I like the office so much.
With over 20 years of dental experience as an oral and facial surgical specialist, Dr. McCullum is your wise choice. Call 773-488-3738 to make an appointment and put your money where your mouth is. Are you embarrassed about your smile? There is hope.
I am very happy with my smile. I never thought I would enjoy my smile again. I had to teach myself how to re-smile after having one dental thing after another and being embarrassed with having braces and having them removed and everything, but I am 100% pleased with my smile.
Every time I smile, every time I look in the mirror, ways in which you may have posed before you didn't think about that you may have been hiding your smile. Now you don't even have to think about it anymore.
With over 20 years of experience meeting the needs of her patients, you can let Dr. Ferguson find a treatment solution that fits your budget and restores your smile. Stop putting off the care you need. Put your money where your mouth is. Make an appointment today. Call 773-488-9075 or visit us at dentaldreamteam.com, because your smile is worth it.